Hi, I'm Dr. Angela Mackay, chiropractor and naturopathic physician, and September is PCOS Awareness Month. So I want to talk to you about what PCOS is and what you can do to treat it. So PCOS stands for Polycystic Ovarian Syndrome. Because it's a syndrome, it's not classified necessarily as a disease, so there are a lot of components to it that may or may not fit your particular case if you think you may be suffering from PCOS. But it is a pattern where women don't ovulate. Eggs build up and create cysts along the edge of the ovary, and it can cause pain. You can have ruptured cysts that can be really very, very painful, and in some cases can become life-threatening. You can have irregular periods, so you can have cycles that are 45 days apart, 90 days apart, really painful periods when you do have them, and have severe cramping and heavy bleeding and difficulty there. It can cause a lot of hair growth around the face, as well as on the chest and abdomen, and it can cause a lot of acne, especially in the jawline and through here. In addition to all that fun stuff, you can also end up losing hair on your head and end up with like nail pattern baldness. It affects fertility, so it can lead to infertility. It can be really difficult to get pregnant, and if you do get pregnant, it can be really problematic maintaining a pregnancy, so you may end up having miscarriages or losses of babies that you were hoping to have. It also increases your risk of heart disease significantly, something like 5 to 7 times the normal rate of any other person. It also greatly increases your risk of gestational diabetes, that's diabetes that you have while you're pregnant, or just generally diabetes, type 2 diabetes. Those health risks are really important to note. Along with those risks comes the risk of stroke, sleep apnea, and if you're not having regular periods, you're not shedding the lining of your uterus, it greatly increases your risk of endometrial cancer. PCOS, or polycystic ovarian syndrome, affects approximately 1 out of 10 women. So this is a super common syndrome that affects a lot of women. A lot of women don't know they have it until they're at childbearing age, but it's something that I see and treat all the time because it is so common. So let's talk about what the motivation is to do something about it. So PCOS, a lot of times when young women start to have their period for the first time in their early teens, it's very often not regular, and that's considered normal for people who are just establishing their cycles. So the first year or two really having irregular cycles, it may be PCOS, or it just may be the normal fluctuation of hormones and getting your cycle established. If that period comes on in your early teens and instantaneously you're having all these symptoms of really heavy cramping, heavy flow, I've had patients who are like throwing up, it's so severe, and having to literally crawl to the bathroom because of the cramping and the pain and the nausea. If it's severe like that, that needs to be fully worked up. Along with that, the acne is a common thing for teens, but if it's especially along the jawline, and especially if there is hair growth associated with it, you want to check that out a little bit more in depth. Some women are a normal weight and they don't have a problem with weight gain, but weight gain is very typical. So sometimes that weight can come on overnight. So you're going along just fine, and then something happens. Maybe you've achieved pregnancy and that stimulated a significant weight gain. Maybe you're going through some sort of stressor and that stimulated a significant weight gain, but the weight just sort of appeared really kind of quickly. And then despite your best efforts is not budging when you change your diet and you start exercising and you do all the things you're supposed to do, it doesn't come off. That can be a trigger that it is PCOS. So the big motivation to take care of this, for some women it could be the cosmetic things, but this really is a fully systemic disease that you want to stay on top of so that you can live healthfully and live your best life. And there is so much more you can do besides just taking the pill or going on some diabetes medication to wrangle this and get it under control and get your life back. PCOS, as you know, can be really challenging to work with sometimes, but it is completely possible to overcome a lot of the challenges associated with PCOS and have regular cycles and not really have any observable problems from it, and put out all those fires and inflammation as a result of the PCOS. I want to share with you a case study for a patient that I had who has PCOS, who's had an amazing success story. So I have a patient who is 29. She'd had problems with her periods her whole life, at least since 15 when she was put on oral contraceptive pill for dysmenorrhea. She'd go 3 months without a period and then be really sick, throwing up, cramping, nausea, vomiting, heavy cycle, and miss 2 weeks of school and not be able to function during that time. So at the time, they did a workup for endometriosis. They didn't consider PCOS because this patient had sort of normal teenage acne, not a lot of hair growth, and not all the signs and symptoms of PCOS, had a normal body weight. Put her on oral contraceptive pill, and she stayed on that until her 20s when she really wanted to have a child. Once she got married at the age of 25 or 26, and then at 27 got pregnant and gained probably 150 or so pounds during that pregnancy, which was disproportionate to what she had been eating. So the weight gain came on suddenly. She didn't have any problems achieving pregnancy or maintaining the pregnancy, but she had preeclampsia, which is high blood pressure during pregnancy, and she didn't have gestational diabetes, but they told her she was right on the edge. So following delivery, she lost a little bit of weight, but not all of it. She was working hard, doing a 1,200 calorie day diet, working out with a trainer multiple times per week, going to the gym every single day, watching what she ate, and actually was gaining weight during that time. And she did that for about 3 months, and then finally said, "The heck with this," and stopped doing it. She had an infant that she was caring for at the time, was a stay-at-home mom, and wasn't seeing any benefit of it, so just decided to stop. She went to her regular primary care doctor, who said, "Well, I think you've got PCOS." They didn't do any further workup or tell her anything else about that condition, just said, "I think you've got PCOS. Here, take the pill, eat less, exercise more." And she's like, I already did that. So I saw her several years down the road. Her child was about 8, so 8 years after the onset of all of this, and we worked together, and it took a little bit of time, but we found several different ways to help, including pharmaceutical medications, dietary changes, sleep changes, and nutritional changes along with the diet. So some supplements and herbs and other things to really regulate her cycle. She wanted to come off the pill, and she wanted to have another child. And so we worked with those things. She's lost 80 pounds and has regular cycles every month. And we're waiting to see about baby number 2. But everything there looks promising. So we'll have to keep you updated on that. And a lot of her problems with, she didn't have hair loss until after the baby was born, which initially that was diagnosed as just like, well, you get a lot of hair when you're pregnant and then you shed it after you have the baby. But it was continuing on further than that. So that has stopped. And so we've been addressing all of those issues with both conventional medicine and naturopathic care. And she's remarkably better and really happy with her progress. We'll go into detail later on what dietary changes and what other treatments that we did for her. So if you're curious about that, you want to know what kind of treatments we use, stay tuned, because we'll be talking about that in just a little bit. And today is Wake Up Wednesday. So I want to talk to you about sleep and wakefulness when you have PCOS and things you can do to mitigate some of the symptoms you might be experiencing. So when we talk about PCOS, it's a syndrome, polycystic ovarian syndrome. So it has a lot of hallmarks, it has a lot of symptoms, but there's not necessarily one obvious underlying cause that we can point to for why you feel the way you do and have the things going on that you're having happening to your body. So one of the things that I found to be really helpful in mitigating the symptoms is addressing sleep. One of the things that seems to be correlated to PCOS symptoms and worsening of symptoms is too much artificial light. So that means turning off all lamps, little LED lights in your light switches or your computer, or turning off the phone. And the phone can be a big source of not just stress from artificial light, but depending on what you're looking at, like looking at the news before bed, that's generally nothing but stress. So you want to calm down that cortisol and calm down that stress and get some restorative rest. But I want to talk for a second about the hypothalamus and the pituitary. So the pituitary, you may have learned in middle school health or high school health as the master gland. And so as the master gland, it is constantly sort of tasting what's going on in the bloodstream and checking out your hormone levels and seeing what needs to be balanced. The hypothalamus helps a lot with that whole process. So the hypothalamus job, it gets all this information from different areas of your body. So 80 to 90% of your brain function is really monitoring functions in your body that you don't have to think about. Am I breathing? What's my body temperature? Where am I in space? All those things take up a lot of your brain's energy to maintain homeostasis. So the hypothalamus a lot of times is looking at your body temperature and checking your core temperature and seeing what needs to happen there. It can be part of the responsibility for having hot flashes. And so it sends a signal to the pituitary to make other hormones. So this whole axis needs to be lined up well for you to function in a state of homeostasis where things are just even keel, smooth running. And when you have PCOS, a lot of times it's not even keel and smooth running. Additionally, a book called Her Blood is Gold, and that was really beneficial because it talked about something called lunaception. So lunaception is the notion of having a small nightlight in your room only 3 nights in the month. So you can pick the 3 nights of the full moon and block out all other light but a very dim nightlight that mimics the light of the full moon, so that you're using that light sensitivity that we all have as mammals to help reset your cycle and help get your cycle back on track. So between shutting off all the artificial light except for those 3 nights of the month and cutting down on extraneous light, screens, blue light from TVs and phones and computers, and setting a regular bedtime, those are all things that can help you get back on track with your sleep, reduce stress, and help regulate your cycle. It is Tactical Thursday, and we are talking this week about polycystic ovarian syndrome and how that may impact your life and things you can do to help heal from it. One of the biggest things that I tell women who come in with PCOS is that we need to change the diet. So when you have polycystic ovarian syndrome, you tend to really not metabolize sugar very well, and you tend to release more than needed insulin. And so PCOS in a lot of ways is a disease associated with insulin insensitivity. So the body just doesn't want anything to do with insulin, and so insulin and blood sugar run around rampantly in the body and wreak havoc because they're very inflammatory. So this inflammation causes a lot of the problems associated with PCOS, including heart disease, high blood pressure, higher risk of diabetes, all things that you don't want. So managing that most effectively is done with diet and exercise. So diets that tend to work well for women with PCOS, a lot of times I may recommend a ketogenic diet to start with. And this doesn't have to be a lifelong thing, the ketogenic diet, but it helps to reset the metabolism so that you're clearing out all that excess insulin and resetting, hopefully, your sensitivity to the insulin and getting a good metabolic reset there. Other diets that work well include the paleo diet. You can do some of these things if you want to be vegan, but the goal here is to have the least amount of insulin produced as possible. So you want to have what's called low glycemic index foods, and so that means that a low glycemic index food is a food that will not spike your blood sugar and therefore won't spike your insulin. The other component to whatever diet you choose, and it depends, the diet that you need to be on is variable depending on your constitution and your values and what works well with just your body. But whatever diet you choose, you really want to make sure that you are incorporating a lot of fiber. And the reason for that is because fiber binds to excess hormones in the liver, and then you carry that excess hormonal burden out when you go to the bathroom. And that can include excess estrogen. So sometimes with PCOS, there may be too much testosterone or too much androgens, or in relationship, there may be more estrogen in balance to not enough progesterone. That doesn't necessarily mean you have too much estrogen, but it's not in balance with the progesterone. So I really like weight training for women with PCOS, because the muscle tissue is the #1 tissue that insulin and blood sugar go to. It's the #1 utilizer and uptake for those compounds. And so you can burn through a lot of that excess insulin and blood sugar by having more muscle mass. And this doesn't mean you're going to be cut or buff or overly muscular in a way that a man would be. It just means you're going to be fit. You're going to have more muscle mass that's going to be able to help your metabolism out and balance out your metabolism in a way that'll benefit you overall. Other things that I recommend for women with PCOS are ashwagandha, because ashwagandha can be very helpful as an adrenal support herb and lowering the cortisol, which can be very high and inflammatory in the same way that insulin is inflammatory. Cortisol, having too much of that can be inflammatory. So ashwagandha helps support the adrenals. It helps support that HPA axis, the hypothalamus pituitary adrenal axis, so that you're supporting the nervous system, you're supporting the hormonal system overall, the entire endocrine system, and helping to lower the cortisol so that your natural sex hormones, the progesterone, the estrogen, can balance out more naturally and not just be sort of squelched by the cortisol. So I like ashwagandha. That's another option. I also, for women who are losing hair, sometimes will recommend saw palmetto. It reduces the conversion of testosterone into a more potent dihydrotestosterone, and this dihydrotestosterone is testosterone on steroids, and it's not very beneficial, and it can be part of the problem with male pattern baldness that a lot of women can get when they have PCOS is that they have too much dihydrotestosterone and it messes up the hair follicles and you end up with male pattern baldness. So I like saw palmetto for a resource for women, especially if you're experiencing hair loss. And then basic anti-inflammatory things like fish oil or turmeric. Like I said, the high cortisol or the high levels of insulin lead to an inflammatory state. So you want to do everything you can to help smooth out the inflammation and put out the fires and work your way towards more health, less inflammation, less insulin, and lowered levels of androgens like testosterone syndrome. And it is Favorite Friday. So I want to talk to you about my favorite things that have worked really well for myself and or for patients to help keep you on track on your healing journey as you're recovering from PCOS. So one thing that I've had patients tell me works really, really well for them is an app called the Carb Manager app. So if you're trying to do a ketogenic diet, or you want to do the paleo diet, or you just really want to keep track of your glycemic index and your level of carbs for the day to help you reduce your insulin levels and blood sugar levels, check out the Carb Manager app. Another website I like when you're starting to plan what you're going to be eating is called sparkpeople.com, and that is also free, and you can sign up on sparkpeople.com. They have a lot of different resources, a lot of different levels. They have paid services there, but they have a really great library there too of food. So if you're planning your meals, you want everything to have as much nutrition as possible so that you're not eating empty carbs, and that helped me a lot with meal planning as well. In terms of diet, you want to eat whole foods, whether you're choosing a keto diet, a paleo diet, a vegan diet, whatever it is, you want to make sure you're eating whole foods. And what that means is you can tell where those foods came from. They look like the thing they were in their natural state. So you can recognize a carrot, for instance, and they're not highly processed and powdered like pastas, noodles, that sort of thing. Or even sometimes protein powders can be problematic for people because they're highly processed. So picking whole, unprocessed foods that you cook yourself, I'm 100% for that. And it doesn't have to be super complicated. So if you didn't grow up in a home where you ate home cooked meals every day, it's okay. There are lots of places that you can find recipes that take you 20 minutes or less to put together and come up with a complete balanced meal. So it can be fun as long as you understand that's a creative process and there's a little bit of trial and error involved. So that's another resource. For my patients who've started out on the ketogenic diet, they really recommend a book by Maria and Craig Emmerich called Keto, The Complete Guide to Success on the Ketogenic Diet. And we'll put a link to that on Amazon for you so you can look that up. But my patients have told me that that is the most comprehensive book for figuring out the ketogenic diet and where they want to start. And it has comprehensive info for figuring out how to figure out your macros and how to come up with recipes and how to combine everything together, come up with shopping lists and everything else so that you don't have to reinvent the wheel and you can just follow along and get the information you need to be successful. Another part of the plan for PCOS is exercise. So I want you to find something that you enjoy that's fun to do. Before the pandemic, I loved playing volleyball. That's not open right now, but I also love kettlebells, and I feel really good about doing that and feel like I've done something worthwhile for my body for the day. I also really enjoy classes because if I show up to a class and I know other people are looking at me, I'm more likely to actually complete the class instead of just pooping out when it gets hard. So it helps keep me accountable, and it sets up a structured time that I actually go to do it. So it's not like it comes to 10 o'clock at night and it's bedtime and I'm like, oh crap, I didn't get my exercise in. So it helps keep me accountable and helps keep me moving. And I really do enjoy exercising and the feeling that I get afterwards. So, and then finally, I want to talk about a basal body temperature chart. So we will be putting one out for you. That'll be easy to follow. But basically, you want to go to sleep at the same time every night, wake up around the same time every morning, so that you're in a good biorhythm to help get your cycle into a natural rhythm instead of being so erratic. And so every morning when you wake up, you want to take your temperature with a basal thermometer, which is different than a regular thermometer. They're a little bit more fine-tuned to get your actual core body temperature. And as you're going through that process, you'll be checking your basal temperature every morning. And then around ovulation, you should see a spike. And there are some other signs of ovulation too. And so you want to keep track of that and see if you are having ovulatory cycles or not, and see if you can get your cycle into a tighter range, at least a normal monthly range of anywhere from 21 to 35 days is normal. But so you're not skipping cycles and having a lot of other symptoms associated with your cycle. So that's my other favorite. It's a really easy, basic tool that can give you a whole lot of information for you and your doctor to go over to help troubleshoot while you're on your journey. All right, I will talk to you soon. Check out all the materials that we have posted for PCOS and let me know what you think.